Good evening, everyone. My name is Allie Smith, and I'm one of the Assistant Directors of Admission here at Villanova University. As a Villanova alum myself, it is a high honor for me to welcome you to our Louise Fitzpatrick College of Nursing Virtual Fall Preview Day. Tonight is all about nursing. For a more admission-related event, please tune in to one of our virtual Villanova visits. There, you will receive a full rundown of the university as a whole and our admission review process. We have an outstanding lineup of speakers here tonight, and while we would love nothing more than to welcome you to campus in person, the online landscape has the unique ability to offer just a little something extra. You can use that Q&A box at the bottom of your screen to ask questions. We'll be working hard to answer as many as we are able in the chat and on screen. Want to hear a bit more about the College of Nursing from a student perspective or have a few remaining questions after this presentation? We encourage you to register for our nursing-specific student-led Q&A panel on September 30th. I'll go ahead and put both links in the chat to both the panel and the virtual visit. But that's enough for me for right now. I'll be in the background too, helping with questions. But without further ado, I'd like to introduce our first speaker, Director of Undergraduate Recruitment and Admission for the College of Nursing, Krista Gardner. Krista, thank you so much for joining us tonight.
Thank you, Allie, and good evening, everyone. And once again, welcome to the Louise Fitzpatrick College of Nursing Virtual Fall Preview. We are delighted that you are joining us this evening, and you're coming from all over the country, and we're so pleased. And we thank you so much for your interest in Villanova Nursing. We are coming to you this evening from Driscoll Hall, which is the home to the Fitzpatrick College of Nursing and our state-of-the-art nursing facility, which offers technology-driven classrooms and seminar rooms, as well as 14 future-oriented clinical simulation labs. Driscoll Hall is designed to educate the next generation of nurses in true Augustan fashion, with a whole-minded approach to nursing, which means Villanova nurses not only excel technically, but also possess keen decision-making skills and demonstrate care with compassion. As seniors in high school, we understand this is a very busy time for you as you focus on your future academic goals and where you will submit your college applications. Many factors will influence this final decision, and one of the most important factors is which program will offer you the best education and where do you feel the strongest connection to community. You have joined us today to gain insight about our nursing program and our unique, deep-rooted Villanova community that extends beyond this campus to some of the most renowned health systems, hospitals, and organizations across this country and around the globe. Villanova Nursing is recognized as one of the premier nursing programs in the country. I believe one of the features that sets us apart is opportunity. As a student, you will be challenged with several unique experiences, the opportunity to obtain an exceptional nursing education, develop strong faculty-student partnerships, and be enriched through academic endeavors such as pursuing a minor, perhaps working closely with our faculty in undergraduate research, or engaging in a global health experience. Our students are encouraged to develop their leadership skills, participate in campus-wide service activities, and have fun as they immerse themselves in a full university experience. Villanova offers a transformation college experience that prepares our students well for their role as professional nurses and helps them build a strong foundation for lifelong growth and success. Our goal this evening is to provide you with a deeper understanding of what we mean when we say, be a Villanova nurse, care with compassion, and practice with purpose. Thank you. It is my pleasure at this time to introduce to you Dr. Donna Havens, Conley Endowed Dean of the M. Louise Fitzpatrick College of Nursing. Dean Havens.
Thank you, Krista. Good evening. It's my pleasure and privilege to serve as the Dean of the Fitzpatrick College of Nursing at Villanova and to welcome you to our fall virtual preview. We're delighted that you are considering a profession in nursing, a noble profession, and we are delighted that you're considering preparing for this career at the Fitzpatrick College of Nursing. I must share that within the last few years, I too had to make a big decision about where I go. I was interviewing for dean opportunities at several universities, and the Fitzpatrick College of Nursing surfaced as the place for me. I arrived here 2 years ago. What drew me might interest you. Villanova is a highly regarded university that continues to spiral upward. The College of Nursing is considered one of the best in the nation. The college is a leader nationally and internationally. It's known for quality educational methods, faculty mentoring and caring, and it's an international leader in the use of simulation and virtual learning to educate nurses. The college has been recognized by the National League for Nursing as a center of excellence in nursing education. It was one of the first 3 in the nation to earn this honor in 2004. And we are proud to have now been recognized 5 consecutive times. Leaders in healthcare organizations across the nation ardently recruit our graduates, and we frequently receive correspondence telling us about the outstanding performance of our grads. I received a wonderful phone call last year telling me that one of our new graduates had saved a baby's life. Our nursing students hold full-time jobs within 6 months of graduation, and last year, the nursing graduates had the highest average starting salary of any other Villanova college, over $69,000. So you can tell I'm bursting with pride as the dean. I'm also an alum, earning my master's degree from the college. Why did I come home to Villanova? Because I cherished my Villanova education and the special environment shaped by the Villanova ethos and mission. Villanova mentoring experience that I had and my Villanova education laid an exceptional foundation for my professional career and my continued growth. It was a great honor and opportunity to come home. My goals for the college would impact you. I'm interested in sparking nursing hunger for innovation, collaborating with the other Villanova colleges to test big ideas and improve health and healthcare. In fact, during the height of the pandemic this year, our nursing students collaborated with engineering faculty to develop and test a ventilator prototype. We continue to build our strong global health preparation, which you'll hear about. Nursing offers an interdisciplinary minor in global health and strong global outreach, possibly going to 13 countries. And we continue to elevate our research productivity. There are many opportunities for undergraduates to work with faculty on their research. Right now, I'm matching interests for faculty and students. Students earn a stipend, valuable research experience, and many actually perform national presentations and publish in highly regarded journals prior to graduating. Another draw for me was I had spent the prior 15 years at UNC Chapel Hill, another wonderful school of nursing, but Villanova has a better basketball team. And this might also be a draw for you. So today you're going to learn from our faculty and our students about Villanova and the College of Nursing. Take it all in and then make a very careful, informed decision about where you decide to apply. To our student visitors tonight, as the Dean at the Fitzpatrick College of Nursing, I promise you an exceptional nursing education. To the parents and friends with us tonight, I promise that we will take good care of your young people and help them to grow into highly competent professional nurses and exceptional young adults. Welcome to all of you, and go Cats.
Thank you, Dean Havens. At this time, I would like to introduce to you Dr. Catherine Lavecchio, Associate Dean and Director of the Undergraduate Program. Dr. Lavecchio.
So good evening, everyone, and thank you for coming to this presentation this evening. And I will echo what Dean Havens just said. I'm a 1985 graduate of Villanova, the first year we won the national championships. So nursing's important, but also your life around nursing. What I'm going to do for the next few minutes is kind of walk you through the curriculum that we have here at the college. We are a very traditional four-year program. We want you to apply to the nursing major when you do apply. It's very challenging to get in across the country right now to transfer into different programs when you get here, so please apply as a nursing major. As we go through the 4 years, we are very traditional. So the first year is your foundational year. You'll take a lot of your sciences, your chemistry, your psychology, sociology courses, but we also offer 2 nursing courses. So I want you to understand that in your freshman year, you start taking 2 introductory nursing courses. Heading into your sophomore year, we're going to add to those sciences, but we're now going to have basic skills in nursing. So you'll be doing some work in our simulation lab, which we are coming from you live tonight in. You will be taking anatomy and physiology and doing lab work there. And you're going to pair together all of the hands-on care with an evidence-based structure. So you're going to take nursing research, you're going to take a statistics course, and also nutrition in those first years. Moving into your 3rd and 4th year here at Villanova, pretty much all of your courses will be on Tuesdays and Thursdays. So you'll take all the nursing courses, pediatric, obstetrics, you'll take community health, health promotion, medical surgical nursing. You'll probably come down to the lab and look and do some work in the operating room. You'll also focus on global health within your curriculum. So those are your course days. On Monday and Wednesdays, and now an occasional Friday, you will be doing most of your clinical work. So we are very fortunate to have clinical partners. We actually have over 70 of them in the region. We work with places like University of Pennsylvania Hospital System, Jefferson, Children's Hospital, Philadelphia, AI DuPont in Delaware. And those are the people that we will be working with. So as I mentioned, we have over 70 different clinical partners. And during COVID, we've actually been very fortunate to have all of our students in a hands-on clinical placement for this semester. So we've been very lucky. The goal for our program is to prepare you to sit for the licensure exam, the national exam at the end of your 4 years. In the past few years, we've had a pass rate on that NCLEX exam of 94 to 97%. So we have a very strong program. This recent graduating class was a 97%. So I know most parents really like to hear that, as well as the students. I also wanted to make note of transportation to clinical. That did come up as a question this week, and I was going to answer it right now. You will be responsible for transportation, but that does not mean you need your own car. We will ask for placements ahead of time, and you may be placed with someone who has a car, so there'll be carpooling if you need that. We also are very closely located to public transportation, so we have a train system, a trolley system. We have a pact with our Zipcar company. We also can use Uber. So there are many different ways students can get to clinical. On average, our clinical agencies are anywhere from 30 minutes to 1 hour away. So we like to let people know that ahead of time so that you can make those arrangements. And we're here to help you make those, so don't feel nervous about that. I also wanted to make note of the fact that we have a very strong undergrad research program. And Dr. Beth Deldell is here tonight, so later in the program she can answer questions. But we do have a first-year match program, which is important for you. If you already are in research during your high school program, you can actually transfer that to here at Villanova and continue working with a faculty member. So that's a very important thing that we wanted to preface. Also, the global health opportunities that Dean Havens mentioned. We have travel courses that can go to different countries like Peru and South Africa, Ireland. We also have a Manchester program that during your sophomore year, you could study in England for the entire year and take nursing courses and actually practice nursing in another country. As Dean Havens mentioned, our starting salary last year was $69,000, and we placed over 90%, actually 98.8% of our graduates were placed in either a full-time position or in graduate work. The other piece I wanted to mention is the ability to minor while you're here. We have several opportunities in a language, in peace and justice. You could be a global health minor. So there's many opportunities to expand those horizons. The last thing I want to mention is our honors program. It is growing yearly. This year we have 2 specific courses that have been offered for honors nursing, but you can major as a double major in honors and take 10 courses. 2 would be from nursing at this point and 8 in your other courses from liberal arts and sciences. You could also minor as an honor student and only have to take 5 courses. Again, 3 from outside our department and 2 within. So that will continue to grow over the next few years as a student, as you would be here. So I'm going to close out and thank you for being here tonight, and we will be around to answer more questions. Thank you.
Thank you, Dr. Lavecchio. And now it is my pleasure to welcome and introduce you to Tanya Sanon. She is a senior in our nursing program, an exceptional student and an exceptional ambassador here within the College of Nursing. And we are delighted that she has joined us this evening. Tanya? Tanya, you have to unmute there you go.
Yes, sorry, we had a little problem with my video.
That's okay.
Good evening, everyone. My name is Tanya Sanon, and I am a senior nursing student from Jersey City, New Jersey. I am so excited to share my Villanova story with you. It's hard to believe this is my last year, and I will graduate in May. When I was a little girl, my parents told me I could be whoever I wanted to be, so long as I was happy. Growing up with a mother who was a registered nurse, I developed a strong interest in the healthcare field. I later realized nursing was the perfect profession for me to fulfill my passion of helping and caring for others. When I was researching colleges, I had an idea of what I wanted. I sought a university where I would be challenged academically and have the opportunity to grow, to be personally challenged through a variety of college experiences. One university stood out amongst the rest, and that was Villanova. It was not too far from home, yet far enough where I could step outside of my comfort zone. The highly respected reputation of the nursing program, its affiliation with exceptional healthcare facilities in the metropolitan Philadelphia area, and the unique educational opportunities offered were very appealing. The medium-sized campus and abundance of extracurricular activities, including multicultural organizations and the community atmosphere, helped solidify my decision to choose Villanova. Our nursing program is grounded in a liberal arts foundation, focused on educating the whole person. Exposure to the Augustinian values of veritas, unitas, caritas, and recently equitas, truth, unity, love, and justice, along with courses like theology and philosophy, taught me foundational principles. The Augustine Culture Seminar course, a humanities course required of all first-year students, introduced me to the writings of ancient and modern philosophers through the lens of St. Augustine, prompting discussion around life's challenging questions such as, who am I and what is my purpose in life? I participated in the Leadership Learning Community, a first-year experience where I examined my courses and co-curricular activities through the perspective of a leader and began to focus on how I could develop and strengthen my leadership skills. In addition to beginning nursing courses my first year, I began to acquire proficient skills through the LEAD program, Learn, Engage, Advance, and Develop, which would help prepare me for my role as a professional nurse. My nursing advisor would offer ongoing support through her academic guidance, professional mentoring, and her desire to help me attain my personal goals. Sophomore year, I began to focus on nursing courses such as anatomy and physiology, health assessment, and nursing research. What I was most excited about was participating in my first clinical experience during the spring semester. At Good Shepherd Penn Partners, I was able to conduct head-to-toe assessments and perform wound care and dressing changes. I accompanied patients to physical therapy, used my therapeutic communication skills, and began to experience nursing in a real-world environment. In the fall of 2019, I began my junior year with challenging coursework that interconnected to demonstrate the multidimensional aspect of nursing. In pharmacology, I learned about medications, their mechanism of action, side effects, and drug interactions. In pathophysiology, I learned about the physiology of diseases and how the body reacts to injury. In my medical surgical nursing theory course, I connected these concepts as I studied various diseases in adult patients. My clinical rotation was at the Hospital of the University of Pennsylvania, where I took vital signs, helped the nurses give medications, and assisted with patient education, as I applied what I learned in lecture to the patient care setting. Each clinical day offered a different experience, which not only helped me piece together the knowledge and skills I learned in theory, but also provided a deeper understanding of what my future role may look like. My second semester began with psychiatric and mental health nursing, for which I was both nervous and excited. Although very different from medical surgical nursing, I was very curious to learn about another dimension of nursing. Through the theory course, my knowledge and awareness of mental health diagnoses such as anxiety, depression, and schizophrenia increased. To prepare us for our clinical rotation, we participated in a specific lab scenario entitled Hearing Voices. Not only was I thankful to have obtained valuable insight, this experience helped me enhance my listening skills and become more compassionate, understanding, and patient. The second half of my spring semester was completely different from what I expected it to be. Following spring break, in response to the pandemic, Villanova transitioned from in-person courses to online courses and an online clinical format. Although we were unable to participate in person for the obstetrical maternity nursing clinical rotation, through the online format, we engaged in discussions and practice assessments, enhancing our critical thinking skills as if we were in the hospital. We worked through case studies to stimulate real-life patient scenarios and wrote papers to expand our knowledge of breastfeeding, discharge teaching, and postpartum depression, among other topics. Although I was disappointed to miss the opportunity to practice in person, it did not diminish the excitement in learning about women's health, labor and delivery, and postpartum nursing care. It's hard to believe senior year has begun. It doesn't look like anything I dreamed it would be. However, I'm excited for the challenges that lie ahead. I am currently in a course called Nursing Care of Adults and Older Adults with Complex Healthcare Problems. My rotation is at the Hospital of the University of Pennsylvania, a 12-hour shift on Mondays. I am on a cardiac intensive care unit where I see patients with heart failure, cardiac dysrhythmias, and other cardiovascular issues. The nursing courses which follow are pediatric nursing, community home health, and leadership and management. Although it may seem I am only focused on my academics, Villanova allows me the opportunity to indulge in my passions through various extracurricular activities. As a member of the Villanova Student Nurses Association of Pennsylvania, the most active chapter in Pennsylvania, and recognized nationally as a stellar school by the National Student Nurses Association, I mentor first-year students beginning their nursing journey. I am part of ACT, the Association for Change and Transformation, dedicated to pursuing justice and equality for all students on Villanova's campus, where I take part in the diversity skit during new student orientation. I'm a nursing student ambassador and a member of the Blue Key Society, where I share my love and passion for the nursing program and the university with prospective students and families. These are just a few of my extracurricular activities in an effort to be a well-rounded student. I enjoy being engaged as it allows me to indulge in my other passions, develop strong friendships, strengthen my leadership skills, and enhance my personal growth. Being a nursing student is challenging. However, I manage my time efficiently in order to take advantage of the opportunities Villanova offers. I cannot believe my Villanova journey is slowly coming to an end. This community supports and encourages you to grow, to find your passions and pursue your dreams. I know coming to Villanova was the right choice for me. I wish you all the best as you continue your college search, and I hope you consider choosing Villanova. Thank you.
Thank you so much, Tanya. And at this time, I would like to introduce our panel who will be joining us for our question and answer session. And our panelists include Dr. Betty Mariani, Vice Dean for Academic Affairs in the Fitzpatrick College of Nursing, Dr. Patricia Bradley, Associate Dean for Inclusive Excellence in the Fitzpatrick College of Nursing, Dr. Elizabeth Dowdell, Professor and Coordinator of Undergraduate Research in the Fitzpatrick College of Nursing. And we're very fortunate to have two of our sophomore nursing students with us, Emily Gallagher, and Dan Doherty. So thank you to all of our presenters, and welcome to all of our panelists, and we will all be here to answer questions for you. I will begin by answering several questions which have been asked regarding the application process for nursing. Students apply to Villanova Nursing through Villanova University through the common application. They complete the Villanova member section and select nursing for their major. There is no separate application for nursing. Villanova is test optional for the 2021 admission cycle, and this applies to applicants for nursing as well. If a student applies test optional, this does not place him or her at a disadvantage. Our review process is holistic and comprehensive. Grades, strength of curriculum, essays, extracurricular activities, and recommendations are all important components of our admission review process, along with test scores if submitted. Math and science courses for nursing are certainly very carefully reviewed. Chemistry and biology are required. AP Chem and AP Bio are preferred if offered. Villanova requires applicants to submit both their common application essay and 2 short Villanova essays. There is no separate essay for the nursing applicants. For the class of 2024, the Fitzpatrick College of Nursing received over 1,500 applications and offered acceptance to 19% of the applicant pool. The middle 50% GPA for the class of 2024 for nursing was the middle 50% was 4.0 to 4.2, and the middle 50% super score for standardized testing was 1370 to 1460. As Dr. Lavecchio mentioned, the Villanova Nursing courses begin in that first semester of freshman year. We are a direct admit program. That question was asked several times. Students will begin their courses in that freshman year. They also begin using the simulation labs in the second semester of freshman year, and they learn how to take vital signs. And that begins their experience in the simulation labs. At this time, I would like to address some of the questions that have been put forward. We have a question from Brandy, who lives in Pennsylvania. And this question is for Allie, and it refers to our merit scholarships. If you could address that, Allie, I'd appreciate that. Thank you.
Yes, happy to, Krista. I'll start by saying that Villanova is mostly a need-based financial aid institution. Because of our Augustinian values, we put emphasis on making Villanova as affordable as we can for as many people as we can. So we are need blind when we review, so we encourage everyone to fill out those FAFSA forms and those CSS forms. There is no downside. When I say need blind, I mean that what you do or do not qualify for as far as financial aid has no bearing on your admissibility to the university. That said, you asked about merit scholarships, so I'll mention kind of our main merit-based scholarship, which is our presidential scholarship. And I mention that because it does have a nomination piece that goes along with it. So someone at your school will need to nominate you by December 1st of your senior year. So you'll have to have all of your application materials in by then, along with that nomination. So the way that works is it's a holistic review of that, nomination piece. And we bring about, in normal times, 60 students to campus to interview, and the award goes to between about 25 and 30. It's a full tuition scholarship. So it's competitive, but definitely worth, applying for and asking to be nominated for if that's something that you're interested in or think you might qualify for. For a list of our other merit scholarships, I'll put a link in the chat to those that have other qualifications that go along with them, but the presidential is our main merit-based scholarship.
Thank you, Allie. We have a question from Hannah in Florida. And the question is to Dean Havens. What action has Villanova taken during the COVID pandemic?
So I could answer that a few ways. Number one is we have engaged all the students and faculty in important work that is going to make a significant difference. For instance, we launched a major study called the CHAMP study on May 12th, which was Florence Nightingale's birthday, to look at the emotional well-being of all healthcare providers and frontline folks working in the pandemic, and students are involved in that. We had students become involved with reaching out through special education, and then they reached out to isolated elderly across the country to keep them company, to talk with them, to help alleviate other problems. The students were engaged in very, very active, as you heard the student tell you, simulations and incredibly creative student experiences. I think Dr. Mariani could tell you more, but kits were sent to them to practice. There was a lot of doing exams on family and friends, et cetera, with videotapes and sending them back to the faculty. So the students, the faculty have been incredibly active. We even got involved with helping to develop and open a surge hospital in a basketball court in Philadelphia, where some of our students were involved in helping to write policies and procedures and all. So it was a great experience.
Thank you, Dean Havens. Dr. Mariani, is there anything you would like to add to that?
I would just add that just to talk a little bit about the kits, each of our students that were here in the sophomore classes during the summertime received each student received an individual kit that they were able to practice the skills and do it by Zoom with their faculty members. So we've just worked really hard to try some very interactive strategies with our students when they aren't actually able to be here in person. We do have several of our classes are in person though. We have our students in the clinical settings now, using all the precautions that are used in the hospital settings as well. And we are using our simulation lab. It's very active every single day. And as you would be in clinical, the students are wearing their personal protective equipment, as we call it, PPE, while they're in the lab as well. So we've worked really hard to try to make the experiences interactive and to get that hands-on experience that you need in nursing.
Thank you, Dr. Mariani. We have a question from Arabelle in New Jersey. The question is, how has COVID impacted nursing clinicals? Dr. LeVecchio, would you like to speak to that?
Sure. I think some of the ideas that we had to pivot to were already mentioned. One of the unique things I thought that Villanova did was not only did we go to a virtual environment in the spring and sometimes this summer, but some very creative ideas came out of the faculty. And the one that really was powerful to me was one of our faculty members was making calls to a healthcare center in Vancouver, and was working with someone in Vancouver that had a lot of homeless patients that had COVID. And so what was happening there was the students were able to learn directly from the healthcare workers in an environment that was virtual, probably something we might not have been able to do if we actually weren't virtual. And one of the things that came from that is not only research, but grant writing. Our students actually wrote a grant to fund a new organization called Outside In, INN. So it is an in to help the homeless patients or people come into the indoors to get treated. So that was one very unique idea. Other things that we have been able to do is things like flu shot clinics, and again, like Dr. Mariani mentioned, very hands-on things, even in the home setting with that equipment that was shipped to them. So we've been fortunate. We're trying to think outside the box, and we actually talk to students a lot as well to find out what would work for them. So I don't think we're at a loss for that right now.
Thank you, Dr. LeVecchio. We have a question from Isabel from Connecticut. And her question had to do with what types of study abroad opportunities are there for nursing students. And I know that Dr. LeVecchio, you touched upon this. I was wondering, Dr. Mariani, if you could speak to the, a little bit more about the opportunities in the University of Manchester, and also some of our global health experiences in more depth.
Mm-hmm. Sure, I'd like to share that with the participants here tonight. So we have several options for international study with our with the College of Nursing, and of course, I just I do want to say that even if you don't do an international experience within the College of Nursing, we do have an Office of Study Abroad, which many of our students explore those options as well, and some of the experiences through campus ministry as well. But the ones that we have here at the College of Nursing, starting with the Manchester experiences, that is a opportunity for students to study abroad for a whole year in Manchester, England. And so this would run from September to July of your sophomore year. So you would do your freshman, junior, and senior year here at Villanova and your sophomore year in Manchester. If you do that program, you would have to take the nutrition course and the developmental psychology course in the summer before you would go, because those courses are sophomore level courses that are not provided during the University of Manchester program. If you decided that you were interested in that, you would have to decide sometime early in your freshman year so that we could help you plan for that and take the courses that you would need throughout your freshman year to be ready to go abroad in your sophomore year. And then students that come back from that enter right into their junior year and continue on with the curriculum as every other student does. We have only a couple of students that do that maybe every year, every other year. So although we have that opportunity, I would say not a large number of students do that, for one reason or another. Some of the students that I've talked to just don't want to leave campus for a whole year. Some of the other opportunities that we have are some international courses. We have an international study course, which really explores healthcare systems, nursing education in other countries. So those are in China, Japan, Poland, and Ireland, and students study for a semester and learn about the culture and the healthcare system in those countries, and then at the end of the semester in May, travel for 2 weeks to those countries with a group of students and a couple of faculty members. We also have international immersion experiences that are part of some of our courses. For example, in our Med-Surg course, students can go to the Dominican Republic as part of a clinical experience. We have clinical experiences in South Africa in our pediatric course, and in our health promotion course, we have experiences in Ghana and Peru. We also have an immersion experience in South Africa in one of those May international experiences where it would be more of a hands-on experience in working with the populations in South Africa. So we have many opportunities. And the thing I will say about the international opportunities and experiences that we have in the College of Nursing is most of these sites the College of Nursing has been working with for many, many years. And we have good partnerships with our colleagues and our partners in those countries. So it's, we don't just, drop in for a week and then come back out again. We work with them all year long in planning the experiences and working with them throughout the year so that, we work as partners with them and not just as an educational experience to fulfill our needs. So those partnerships have been really just great experiences for our students. And some students have gone to South Africa with their pediatric course in this fall, their senior year, or in their junior year at the end in May, and then go back again in their first semester in their senior year because they've had such positive experiences with that.
Thank you, Dr. Mariani. And I also wanted to mention that for any of our students that decide to pursue a minor in Spanish, we also have a program in Cadiz, Spain. For our nursing students, it would be after freshman year or after sophomore year, where they have the opportunity to live with the host family for 6 weeks, totally immersed in the culture. And they take 6 credits at the university. And those 6 credits then would apply toward their Spanish minor. And they also visit the hospitals and gain exposure to the healthcare system as well. So that's an additional opportunity offered to our students. We have a question from Juliana in New York. And the question has to do with, does Villanova offer a direct path to becoming a nurse practitioner with a concentration in psychiatry? I would like to have Dr. Bradley, if you would, please respond to that. And also, the other question I would like for you to respond to is how many students go on for their master's in nursing?
Thank you, Juliana, for asking that question. I am a psych mental health nurse, so that's pretty special to me. Currently in our master's program, we do not have a nurse practitioner in psych nursing program, but we're working on it. We have begun an application to create that program. Other nurse practitioner programs that we have are majored in primary care, in pediatrics, in family nurse practitioner, as well as in adult and gerontology. About 25% of our students, of our graduates, go into our master's in nursing program.
Thank you, Dr. Bradley. And there was a question about research opportunities for our nursing students. I know Dr. Lavecchio touched upon that, but Dr. Dowdell, I was wondering if you could expand upon that for us.
Of course, thank you. Always happy to talk about research. It's the base, it's our science, it's our profession, it's how we move forward, it's how we sit at the table with everyone else. And here at Villanova, and certainly within the College of Nursing, we have a very dynamic and growing research program for undergraduates that offer not only funded, paid opportunities, but of course, unpaid or voluntary. Most of these we find freshman, sophomore, junior year, and we usually use the senior year as an opportunity to travel and to present at national and international conferences, because the College of Nursing also has funding available for students in that nature. We have a trajectory where we see first year and second year students working with faculty on projects, and then second and third year into senior year, we'll see independent projects working alongside a faculty member or mentor that are paid. And so there's a stipend, there's oftentimes room and board associated. And then we also have undergraduate students during their summer situations going and participating in other research opportunities across the country, usually back where they live. So it's a wonderful opportunity and a growing program here.
Thank you, Dr. Dowdell. And now to our students. We had questions that came from many different students, and I would like you each to speak to these, if you would, please. Tanya, if you could speak to what your favorite Villanova experience has been thus far, I'd appreciate that.
Yeah, that's actually a hard question, being a senior and having had so many Villanova experiences. I would definitely say one of my favorites was my freshman year when the men's basketball team won the national championship. I saw, like, it kind of felt like magic because we had won in 2016 and I had heard about it, but being on campus for the experience was definitely one of my favorites.
Thank you. We have questions for Dan and for Emily, and those questions have to do with why did you choose to pursue nursing? And Dan, if you would like to begin, and also why did you choose Villanova? And also what has been your favorite experience thus far?
Thank you. So I'm going to start with your the latter of your questions with my favorite memory. And thus far, I would have to say that it was Hoops Mania last year. I know some of you might not know what that is, but that kicks off the basketball season here at Villanova. And there's always a performer. And last year it was Sway Lee. I'm not a huge hip hop rap guy, but it was definitely a fun experience. And obviously you get to hang out with a lot of your friends. And it's almost like a game feeling. And I know a lot of freshmen got tickets. It's always a hot ticket to get. And then for why did I choose to pursue nursing, I would have to say I was lucky enough to get an experience, or I guess multiple experiences within like family experiences. And then I also got to be in an experience over the summer. I got a summer job with a family from my high school who runs a senior living facility, and that is the type of nursing that I'm most interested in. And I was really happy for that opportunity. And those experiences always solidified the path in which that I wanted to go. And that would be the reason why I chose nursing. A lot of family members, growing up with them, they helped to shape the way. My mom was a nurse and my mom's sister was a nurse. So I've had nursing in the family. I never really asked them about their nursing paths, and I know they're very different than what I was interested in, but they're always open and they love talking about it. And they're always so excited to see me pursuing in a way that they did. And then why I chose nursing, I'm not gonna lie, as Dean Havens said, it's highly regarded. I know I was looking at some rankings earlier the past few weeks, and I know when I applied, Villanova was number 5 in the nation, and I know it's pretty good to see that now we're number 4, so we keep moving up. And my parents both went to Villanova, so I've always known about Villanova. I've always been exposed to Villanova. I was going to basketball games since I was 7 years old, always been on campus, so I was really happy. And I couldn't think of being anywhere else, really.
Thank you so much, Dan.
Krista, could I just add something?
Yes,
please?
absolutely.
I just wanted to stress that more and more men are choosing nursing. And in this year's freshman class, we have 18 men. So.
Yes, thank you for mentioning that. And thank you, Dan, for your comments. We so appreciate that. And Emily, last but not least, we want to hear from you why you chose nursing, certainly why you chose Villanova, and what your favorite experience has been.
Thank you. So I feel as though I don't have one particular moment where I knew that nursing was for me, but knowing how influential nurses are in the lives of patients and those who they interact with, and their presence for the best moments of a patient's life and the worst moments of a patient's life and every moment in between, you're there as a form of support and as a form of hope and as a form of strength and as a form of trust. And I knew that I would want to be that person for someone, and even if it's just at least one person that I can be that for, I knew I was doing something right. And I wanted to integrate my love for science and for math and do it all, and nursing offers it all for someone. But I also love how expansive nursing is and how you're able to do so much with nursing. It doesn't have to be working in a clinical setting. You can be a travel nurse, you can work with nursing business, you can do so much, and I feel as though you won't feel ever stuck. In nursing, you're always learning. And that's something that was really important for me. You don't graduate and that's all you know, you're always learning. And so I think what drew me to nursing most was the patient-nurse interaction and just the expansive nursing. Then going off of that, Mrs. Gardner was touched on it earlier, but you'll hear a lot with Villanova, this idea of a Villanova nurse. And I never really heard that with other schools. And Villanova Nurses, as Mrs. Gardner was saying, it goes beyond the walls of Driscoll Hall and Villanova. It expands to all areas of the country. And you feel it and you learn by example in the nursing school of Villanova, and you see it here as you're talking to everyone a part of this panel. But I knew I wanted to go to Villanova because of the level of example and the level of success, and how every single person in the nursing program wants you to succeed and wants you to do well, but you're also learning off of professors and administration and staff who are also just as motivated for you to do well and want you to succeed and have success of their own. And I wouldn't be lying if I said I chose Villanova because of the amazing community that we have here in the school spirit, which also ties into my favorite experience at Villanova, which going off of what Dan and Tanya said, has to do with basketball, but I can promise you basketball is not all Villanova has to offer. There's so many other ways you can get involved and have a great experience, but my favorite memory was last December. Villanova had played Kansas right before the holidays at the Wells Fargo Center, and it was a sold-out game. I don't think there was one empty seat, and Villanova had beat Kansas by 1 point right at the buzzer, and at that moment, you could just, the school spirit was so contagious and radiating, and every single person there had such a love for the school, and I feel like you really don't get that many places, just such a fond love and passion for the school that you go to, and yet that translates to being on campus too, and everyone just loves being here. You feel at home at Villanova, you feel welcomed, you feel supported, and I could talk about all my favorite experiences all day if I could, but I think you're just gonna love every bit of it.
Thank you, Emily. And just to add to what you mentioned, we have over 8,000 Villanova Nursing alumni who are very involved, or I should say, like to be very involved where they can be in helping our students with their externships and some of the opportunities that students have as they prepare for their professional role. And it is wonderful to see the love and the passion and the commitment on the part of our alumni for not only the university itself, but certainly for our future graduates as well. And we're very, very grateful for that. And it just speaks to the wonderful education that they received here at Villanova and the love and passion that they remain near and dear to their hearts as they as they become adults and move on with their careers and their personal lives. Yes.
I just can't let this chance go by. We have Dr. Patricia Bradley with us, who is a psych mental health nurse. This week, yesterday, she took on the role of our brand new Associate Dean for Inclusive Excellence, which is going to add so much richness to the college. So I wanted you all to know that.
Thank you, Dean Havens. So at this time, I would like to speak to the, there's a question about, is it possible to transfer into the nursing program if you decide that you would like to pursue that major? And it is possible. It is an opportunity that does come about in junior year. And it's an opportunity for students to submit their application in second semester of sophomore year, be considered for the program, and then they would begin in the fall of their junior year. It is a 5-semester commitment, and the students then would finish in August after their senior year, having completed one additional summer. And it is competitive as well. We do have opportunities for students to do so, but it would not begin until junior year. We have another question from Sarah, and her question is, what is the attrition rate for the program from freshman year to graduation? We actually have approximately 91% of our students that graduate in 4 years. So they may leave for personal reasons, they may switch to a different major, but we have a very high retention rate over the course of the 4 years. We have a question, and that is, what do we recommend for our students to include in their application essays? So there are 3 essays that are involved in the application process. One is for the Common App, and 2 are for Villanova. We do like to see a student really speak about what it is that they are interested in with regard to pursuing a major in nursing, and what has brought that about, and really speak of your own personal experience. It gives us an opportunity to get to know you as an individual. And then one of the Villanova member section essays is your opportunity to share why you're interested in Villanova and your life experience and what you would bring to the ethos of the Villanova community. Let me see. So one of the questions is, how is the environment as a student? Are there a lot of activities to do outside of studies? And I would ask one of the students to speak to that, if you would. We've talked a lot about the academic piece, but I think the question here is, what do you all do for fun? How do you immerse yourselves in the university student body? So I would love to have one of the students speak to that.
Yeah, I would love to speak to that. I feel like Villanova, I mentioned it earlier, it's such a community-based university, and there are so many ways to get involved. Personally, I'm involved in Nova Dance, which is a year-long fundraising effort that benefits pediatric cancer awareness and research. So with that, at the end of the year, we come together for a 12-hour dance marathon, celebrating our efforts and celebrating our heroes who are fighting pediatric cancer. So with that, I am on the executive board. I'm also involved in SNAP, which is the Villanova's chapter of the Student Nurses Association in Pennsylvania. I am involved with club volleyball, so club sports are really big. And so many, I could talk about so many more, but it is very possible to get involved. At Villanova, especially with nursing, it's a challenging curriculum, but it really is. Going to Villanova, being involved in so much, you really get the whole experience. With Special Olympics, I could talk about it forever, but there are numerous ways to get involved if you wanted to.
Thank you. Dan or Tanya, do you wish to add to that?
Yeah, I can add to that. There are over 265 clubs and organizations at Villanova that you can get involved in. I know that because, as I mentioned earlier, I'm in the Bouquet Society, and we are the campus tour guides and ambassadors. And it is one of my favorite activities to be involved in because, like I said, I love sharing my experience with prospective students and families. And there's, like Emily was saying, there's just so many ways to get involved, even though nursing is challenging. One of the things I love about Villanova is that you do have the opportunity to do something outside of nursing, and that honestly allows you to grow even more, because I know one of the organizations I'm involved in that I didn't mention is SAMOSA, which is the South Asian Multicultural Organized Student Association, and many of the students in that organization I would not have met if I wasn't in that organization because they're not nursing students. And it just shows how involved you can get and how you can meet all these different people from different places, different majors, and just be so involved in the college experience, because it's not just about academics, it's also about what you do when you're not in class.
Thank you. Dan, would you like to add anything to that?
Nothing specific, but I know that Tanya mentioned the Blue Key Society, and there's a bunch of other clubs that get really high regard and a lot of applicants for, I guess, acceptance into their clubs because they're highly regarded. And the Blue Key Society is probably one that gets the most applications because everyone always wants to share their story as to why Villanova is the right fit for them, and obviously wants to draw all the prospective students to Villanova. And so obviously she has many more, has all the answers, not all the answers, but has the right information saying the over 260 clubs. So there's always something to get involved with, and it's not a solely academic campus.
Thank you, Dan.
Krista?
Yes.
Hi, it's Pat Bradley.
Yes.
Yeah, I just wanted to make a comment as a faculty advisor. Dr. Dowdell and I have been here past 20 years now. So we've had the experience of having freshman students as our advisees. When you first come to Villanova, you're assigned an advisor. And we get to hear all about, you know, what courses you want to take and then what clubs you want to belong to. There's an activities fair that's, you know, within the first month of school, and you meet all the people from the clubs. And then our favorite question might be, when are you sleeping? And the other question that we would ask as an advisor, what's green that you've been eating? So we talk about sleep and eating. We talk about managing stress, but you know, your advisor, once you're here, is your home away from home in terms of being able to ask you those important questions about the quality of your life and how you're managing all those things.
Thank you, Dr. Bradley. And we do have an additional question about summer internships. And I was wondering if Dr. Mariani, if you could speak to that.
Sure, Krista, thanks. Many of our students do find positions after they've had their first clinical experience in their sophomore year. So between sophomore and junior year and between junior and senior year, many of our students will work as nurse externs. Also, as you know, because we are have such a very good reputation in the Philadelphia area, we will frequently get requests from local hospitals, from other programs such as Independence Blue Cross. Oftentimes we'll hire some summer interns to work on various programs that they have. We also have, which maybe Dr. Dowdell will want to talk about, but we also have some opportunities for summer research that students can do with faculty members or on their own through the Villanova Research Center for
Research and Fellowships.
Fellowship. They changed the name recently, Center for Research and Fellowship. So there are many opportunities, and we also have a wonderful career center here that we work very closely with to, and they as they get job postings, they will have them available for students as well. So a good number of our students do work in some sort of a nursing job over the summers, beginning with their sophomore summer. But one of the things that I always tell my students that I advise as well is that, you know, if you can get a job in some sort of a nursing or healthcare position during your summers, that's great, but there are many other things to be gained from work experiences. So even if it's not a specific job in a hospital, you know, working in some other setting, you know, getting along with other people, showing up on time, and doing all those things that you do when you are a responsible employee also helps with your job applications when you graduate.
Thank you, Dr. Mariani.
If Krista, if I could just add, there's also
Yes.
the Oncology Fellowship that are available in the summer to juniors, I believe, where we're part of a fellowships that are offered to student nurses across the country. People usually pick one of the hospitals involved near their home. Whereas I think we had 4 last year at the University of Pennsylvania. Some go to Connecticut, some go to New York City. And you're actually paid for about 6 weeks to work in one of the most outstanding oncology hospitals in the nation. It's clinical practice with oncology nurses, and there's also didactic. There are classes involved. And often those students walk away with a job offer or a likely job offer for after they graduate.
Thank you. And Dr. Dowdell, is there anything else you wanted to add to that?
Only that we certainly value the opportunities that we have here at Villanova, and we use our best networking abilities to ensure that we are able to get students to experience opportunities perhaps around their own homes or in areas where they would like to move. And we also have a real philosophy of, if you're going to do the work, you should probably have a deliverable from it. So we do take from sort of the business model of talking about what are outcomes, what are deliverables, and for most of our students, especially those involved in research, we have students partnering and publishing. It was mentioned earlier, but we have them publishing in tiered journals. We have them publishing either as first or second authors, and we have them presenting posters, brown bag development sessions, and reaching out across campus. We have right now a nursing group that's working with the College of Engineering. We have for our first time nursing students working in Innovate, again, which is part of a summer program through engineering, not on the respirators, but on a Billy blanket for premature infants. That was an idea launched by one of our faculty members. So we are a strong presence here on the campus, and our students are doing things that, you know, are changing the world and building on our science.
Thank you, Dr. Dowdell. So I know we have additional questions that have not been answered. Out of respect, however, to our panelists and all of our participants, I believe at this time we need to close our session. Please feel free to email me and I will be happy to respond to your questions. I know that my colleague Ali Smith mentioned that there will be a student panel on September 30th that we invite you to attend as well for additional questions to be answered. We are here to help you through the process, and we will support you in any way we can. So please feel free to reach out. And I do apologize. I know that there are other questions that have remained unanswered. However, I do wish to be respectful to Dean Havens and our faculty and students this evening at the time frame that we have right now, which is after 8 o'clock. So thank you so much. And you certainly can feel free to send your questions either to me or to go to Villanova. And we will certainly get back with you as soon as possible. Again, thank you so very much for your time this evening, for joining us from all over the country. We're honored that you took the time to be with us this evening. We hope that you will continue to remain interested in Villanova Nursing. We certainly look forward to helping you through the application process, and we wish you to stay well, and thank you again for joining us this evening. And thank
Become a Nova nurse.
Yes, right. Thank you, Dean Havens. Thank you to our faculty and our students. So grateful for your participation. Thank you.
Bye.